So, I mean, I think that patients do have a bias against chemotherapy. There's a lot of it's out in the press as well as in the literature saying that chemotherapy is difficult to tolerate. And I think that chemotherapy side effects are dependent upon patient selection, their age, their comorbidities, and also some of their cancer comorbidities as well, weight loss, fatigue, bone pain. We know that we can see improvements in bone pain with both chemotherapy as well as next generation anti-androgens. And again, as we saw in the CARD trial, the patterns of toxicity are different. So what I think the counsel the patient that you may expect side effects, we can alleviate some of them, such as neutropenia with growth factors. Also, if they develop edema from chemotherapy, that they can also receive diuretics. Same thing with the next generation agents. You've got to watch their blood pressure. You watch their liver function tests. All these need to be monitored. Good monitoring is very, very important for these particular patients. So in summary, if a patient is leery about chemotherapy and there are no other options, I often will say to them, start and give it a try and see what happens. Most side effects are irreversible. And if you're feeling tired or fatigued, that eventually will wear off. So I think, again, you've got to look at your options, look at your patient, and understand where they're coming from. One of the important measures of outcome in patients with bone metastases and metastatic castration-resistant prostate cancer is relief of pain. So Dr. Fizazi took 255 patients from the CARD trial. Of those 255 patients, about 2/3 of those patients had moderate or severe pain at the time they were randomized. And what he did was he evaluated the pain response in those patients who were treated. And the pain response was significantly better, about 45% in those patients who received cabazitaxel versus about 19% in those patients who received either abiraterone or enzalutamide. So this is, I think, a very, very significant finding, because not only are we seeing an improvement in survival and progression-free survival, you're seeing an improvement in the patient's overall quality of life related to their particular pain response. So the time to deterioration of pain was also longer in the cabazitaxel patients, basically saying that this is a more durable response overall. So I think that this is significant, again, in a patient who may come in with bone pain. They may need rapid relief. They may see a more rapid relief, a more complete relief of their pain with cabazitaxel than they would with a next generation agent.